You do everything the doctor tells you. You take your statin every single morning without missing a dose. You skip the bacon at breakfast, even though you miss it. You watch somebody in your own family go through a bypass surgery, the tubes, the recovery room, the weeks of rehab, and you swore to yourself that would never be you. And yet the plaque inside your arteries may be building right now, quietly, in a way that none of that effort actually touches. Because the one habit that genuinely protects the lining of your blood vessels does not cost a single dollar, and almost none of my patients over 50 are doing it. Before I show you exactly what that habit is, I want to ask you for something small. This channel is trying to reach 1,000 subscribers so that YouTube starts placing videos like this one in front of more people just like you, people trying to protect their heart before surgery becomes the only option left on the table. If you are not subscribed yet, tap that button right now before you keep watching. It costs you absolutely nothing, and it means one more person over 50 finds this information while there is still time to use it. By the way, my name is Dr. Matthew Clark. I am an internal medicine and preventive health doctor, and I have spent the last 15 years working directly with men and women over 50 who are trying to protect their heart before it fails them the same way it failed someone they loved. I am not a surgeon. I do not perform bypass surgery, and I never want to be the reason you eventually need one. My entire job, the reason I get up and make these videos, is trying to make sure that surgery is a conversation you never have to have. Let me ask you something before we go any further, and I want you to actually answer this honestly in your head. After you finish dinner tonight, what do? Does the plate go in the sink, and then you walk straight to the recliner or the couch for the rest of the evening? Do you finish the meal and sit right back down in the exact chair you were sitting in before you ate? If that is your pattern, and for the overwhelming majority of my patients over 50, it absolutely is, then everything I am about to explain applies directly and specifically to you, tonight, at your very next meal. Here is what almost nobody explains clearly, not because doctors do not know it, but because a 15-minute office visit rarely leaves room for it. Every single time you eat a meal, especially one containing refined carbohydrates or a heavy amount of fat, your blood sugar and your triglycerides rise sharply for the following 1 to 2 hours. Doctors refer to this window as the postprandial period, which simply means the stretch of time right after eating. During that window, something specific happens inside the thin layer of cells that lines the inside of every blood vessel in your body, a layer called the endothelium. Picture the endothelium as the inner skin of every artery you have, normally smooth and slick, so that blood glides through without friction or resistance. When sugar and fat spike sharply after a meal, and then you sit motionless while your body slowly processes that spike, the endothelium absorbs a small amount of stress with every single one of those spikes. One spike on one afternoon will not hurt you. But 2, sometimes 3 spikes a day, absorbed while sitting in a chair, repeated for years and sometimes decades, is exactly how the smooth inner lining of your arteries gradually turns rough and inflamed. And a rough, inflamed lining is precisely the kind of surface that cholesterol and plaque love to grip onto and build up on, layer after layer, year after year, until one day an artery feeding your heart is narrow enough that a surgeon sits you down and tells you the only remaining option left is a bypass. There is a second piece of this that rarely gets mentioned outside of a cardiology textbook, and I think it is worth you knowing. Alongside the direct stress to the endothelium, a sharp postprandial spike also triggers a small, short burst of inflammation in the bloodstream, measurable through markers with names like C-reactive protein. On its own, one small inflammatory burst is nothing to worry about. Your body handles it and moves on within a few hours. But repeated 2 or 3 times daily, for years, that low-grade inflammation becomes part of the same slow chemistry that helps plaque form and eventually helps it become unstable enough to rupture, which is the exact event that triggers most heart attacks, not simply the narrowing itself. I want to come back in just a moment to why the timing of what you do after a meal matters so much more than most people ever realize, arguably more than the exercise itself. But first, I need you to understand what most people over 50 genuinely believe about preventing all of this, because it is almost completely incomplete. Most people over 50 believe the number on their cholesterol panel tells the entire story of their heart risk. They believe that if their LDL number is low enough and their doctor seems satisfied at the yearly checkup, their arteries must be safe. Here is the more complete reality. Cholesterol absolutely matters, and I am not telling you to ignore your numbers. But a growing and consistent body of research shows that the frequency and severity of these after-meal blood sugar and fat spikes, and how much cumulative damage they do to that thin endothelial lining, is linked just as strongly to plaque buildup as your baseline cholesterol number is. You can walk out of your doctor's office with a perfectly acceptable cholesterol panel, feeling relieved, and still be quietly damaging your arteries 2 or 3 times a day, with every single meal you sit through afterward. There is a second myth tangled up with the first one, and it is just as common. Many people over 50 assume that if they felt something was wrong, chest tightness, real shortness of breath, unusual fatigue, their body would tell them clearly, and they would act on it. The uncomfortable reality of coronary artery disease is that it is frequently silent for years while it progresses, precisely because arteries can narrow gradually enough that the body quietly compensates, right up until a single blockage crosses a threshold and produces a heart attack with almost no earlier warning at all. Waiting for a clear symptom before taking prevention seriously is, for many patients, waiting for information that never arrives in time. Let me put a real number next to the title of this video because I think it matters. A coronary artery bypass surgery in the United States typically costs somewhere between $60,000 and $200,000 once you count the surgeon, the hospital stay, the anesthesiologist, and the months of cardiac rehabilitation that follow, with a more conservative estimate closer to $70,000 or $80,000 once you average across hospitals. Though for many families, the out-of-pocket portion alone, once deductibles, co-insurance, and lost time at work are added together, lands remarkably close to that $30,000 figure in the title of this video. I am not sharing that number to frighten you for the sake of frightening you. I am sharing it because the intervention I am about to describe, the thing that genuinely influences whether that surgery ever becomes necessary for you, costs exactly $0, requires no insurance approval, no waiting room, and no referral from anyone, and takes no more than 15 minutes out of an evening you were already going to spend sitting down regardless. Here is the part that changes everything, and it is the zero-cost habit I promised you at the very start of this video. A walk. Not a long one. Not a gym membership. Not special shoes or a treadmill in the garage collecting dust. A slow, easy, unremarkable walk lasting 10 to 15 minutes, started within 30 minutes of finishing a meal. That, in its entirety, is the habit. I want you to picture your bloodstream right after a heavy meal the way you would picture a river taking on a sudden surge of water after a storm. If that extra surge of water simply sits and pools against one section of the riverbank, it erodes that one spot badly, wearing it away a little more with every storm. But if that same volume of water keeps moving, spreads out, and flows through the system, it causes almost no damage to the bank at all. Walking after a meal does precisely that inside your blood vessels. It pulls your working leg muscles into actively using the glucose and fat that just entered your bloodstream, instead of allowing that fuel to sit and spike against the walls of your arteries for the next 90 minutes. The spike still happens. Some rise in blood sugar after eating is completely normal and even necessary, but it becomes shorter, smaller, and considerably gentler, and your endothelium absorbs far less punishment from it, in much the same way that riverbank absorbs almost nothing when the water is allowed to keep moving instead of pooling in one place. To put a real number on this, several published studies looking at short postprandial walks in adults with elevated blood sugar have found reductions in the after-meal glucose spike in the range of 20 to 30% compared to remaining seated for the same period. That is not a small effect. Applied across 2 or 3 meals a day over months and years, a reduction of that size is genuinely enough to meaningfully change the trajectory of plaque buildup inside your arteries. even though you will never see the number directly because nobody routinely measures it in a standard checkup. Now, here is the timing detail I told you I would return to. This is not simply about getting your daily step count in whenever it happens to be convenient for your schedule. A brisk walk at 10 in the morning does very little to blunt the spike created by the dinner you ate the night before, because that spike has already come and gone hours earlier. The protective effect is tied specifically and narrowly to the window right after eating, generally within the first 30 minutes for the strongest benefit. Wait 2 full hours before moving your body, and the spike has already done the majority of its damage before you ever stood up from the table. This is exactly why so many people who genuinely consider themselves active, who faithfully walk every single morning before breakfast, are still quietly building plaque they have no idea exists, simply because they are walking at the wrong time relative to their meals, not the wrong overall amount. I see this exact pattern constantly in my own practice, almost weekly. A patient comes in fully convinced they are doing everything right when it comes to their heart. They walk 3 miles most mornings before the sun is even fully up, rain or shine, and they are proud of it, as they should be. Their cholesterol numbers look entirely fine on paper, sometimes genuinely excellent, and their blood pressure sits comfortably in a normal range visit after visit. And yet their coronary calcium score, which is a direct imaging measurement of actual plaque buildup inside the coronary arteries feeding the heart, keeps climbing year over year in a way the morning walk alone simply does not explain. It is confusing to them. And honestly, it used to be confusing to me too, earlier in my career, until I started asking a very specific follow-up question during these visits instead of simply reviewing the numbers on the chart and moving on. I used to focus almost entirely on the morning routine because that was the part patients volunteered proudly, unprompted, at the start of every appointment. It took years of seeing this same disconnect between effort and outcome before I started deliberately asking about the other end of the day instead. When I finally ask what a typical evening looks like for them, the answer is almost always identical. Dinner around 6 or 6:30, and then straight to the recliner for 3 or 4 hours before bed, most nights of the week, television on, feet up, completely still. The morning exercise was completely real and genuinely admirable. It was simply happening at a time of day that did nothing to protect their arteries during the specific hours they were most vulnerable, which is the 2 hours right after their largest meal of the day. There is no billing code for a 15-minute walk after dinner. Nobody in the healthcare system gets reimbursed for telling you to stand up after a meal and go around the block. A stent procedure generates a facility fee. A bypass surgery generates a full surgical team, an operating room charge, an intensive care stay, and weeks of follow-up appointments afterward. A short after-dinner walk generates nothing for anyone in the system, except a slightly stronger, slightly smoother artery wall for you. I am not telling you this to make you angry at your doctor personally. Most doctors I know care deeply about their patients and simply do not have 15 spare minutes in a rushed visit to explain postprandial physiology in this kind of detail. I am telling you this because the financial incentives surrounding you were never specifically built to hand you this piece of information, so today I am handing it to you directly, at no cost, because that is the entire point of this channel. If what I just explained genuinely landed for you, please take 15 seconds right now and share this video with someone in your life who has already had a stent placed or who is currently sitting on the fence about a bypass recommendation from their cardiologist. This one detail about timing could meaningfully change what happens to their arteries over the next 5 or 10 years. And if this channel has helped you understand your own heart even a little better today, hitting that subscribe button costs you absolutely nothing and helps me reach the next person who needs to hear this just as urgently as you did tonight. I want to ask you a quick question down in the comments below, and I promise you it genuinely shapes what I recommend and what I make next for this channel. How old are you? I ask because the exact walk I am describing looks meaningfully different for a 78-year-old managing joint pain than it does for a 55-year-old who is still working full-time and juggling a packed schedule. And I want the advice underneath this specific video to actually fit the real person reading it, not some generic average viewer who does not exist. I read every single comment on these videos personally, and the age you share genuinely shapes which follow-up video gets made next, whether that means a version of this walk adapted for someone recovering from a hip replacement, or a version aimed at someone who is still commuting to a full-time job and needs to fit this into a lunch break instead of a leisurely evening. Here is a statistic that tends to stop most of my patients cold when I say it out loud in the office. A single missed opportunity to walk after one heavy meal is not really the problem here at all. The actual problem is that the average American over 50 sits through somewhere between 2 and 4 of these unprotected blood sugar and fat spikes every single day, 7 days a week, for decades in a row without ever realizing it is happening. That is not one bad moment on one bad day. That is thousands upon thousands of small, invisible stresses landing on the exact same stretch of artery wall near your heart, compounding quietly year after year, while your yearly blood work continues to look completely unremarkable and normal. If you sit down and actually do the arithmetic across a single decade, 3 spikes a day adds up to somewhere near 10,000 separate unprotected moments landing on the same few centimeters of artery wall, which is precisely the kind of repetition that turns a survivable, ordinary process into a surgical one over time. I promised you I would return to the timing question one more time, because there is a second layer to this that most people miss entirely. It is not only about when you walk after a given meal, it is also about how consistently you protect that specific window, meal after meal, day after day, not just occasionally when you happen to remember or feel motivated. One protected meal a week barely registers with your arteries at all. The endothelium responds to sustained pattern, not to isolated good days scattered here and there. This is the same reason a single healthy dinner cannot undo years of accumulated damage, and it is the exact same reason a single after-dinner walk cannot either. Real, measurable protection comes from what you do on most ordinary days, not the handful of days you happen to feel especially motivated. I also want you to hear about a specific moment that comes for almost everyone who takes this seriously, because I would genuinely rather warn you about it now than have you feel like you failed later on. Somewhere around week 2 or 3 of walking after meals consistently, you are going to start feeling noticeably better in ways that have nothing to do with your arteries directly. Less bloated after dinner, better, deeper sleep, maybe even a little more energy and lightness in your step by morning. And that improvement is exactly the moment most people quietly, almost invisibly, stop the habit. They feel fine now, so the walk starts to feel optional again, something they can skip on a busy night without consequence. I want you to understand clearly that feeling better is not the finish line here. It is actually the earliest possible outward sign that the habit is working on the inside as well, on the exact tissue you cannot see or feel directly with your own senses. The real test of this habit is not day 3, when the novelty is still exciting. It is month 6, when the habit has to survive on its own, without the daily reward of noticing it, through a holiday season, through a stretch of bad weather, through the nights you are simply tired and would rather sit down. Before I give you the complete plan, right now, wherever you happen to be sitting or standing while you watch this, I want you to do something simple with me. Place 2 fingers gently on the side of your neck, just below your jawline, and feel your pulse for a few seconds. That steady beat you are feeling right now is pushing blood through every single artery we have been discussing throughout this entire video. It is genuinely worth protecting, and it is worth beginning to protect starting with your very next meal today, not next Monday, not after the holidays, today. So here is exactly what I want you to do, starting with your very next meal. The first step, finish your meal exactly as you normally would. There is no need to change what you eat or how much of it for this particular habit to be effective, although eating slightly less at any one sitting never hurts. The second step, set a timer for 10 minutes after your last bite, using your phone or a simple kitchen timer, so that you are not relying on memory alone once the dishes and conversation pull your attention elsewhere. The third step, when that timer goes off, get up and walk. Around the block outside, around your living room if the weather outside is bad, up and down a hallway inside your home, It genuinely does not matter where you walk, only that you do. The fourth step, keep the pace easy and fully conversational the entire time. This is not meant to be a workout or a cardio session. If you find yourself too out of breath to comfortably hold a conversation, slow down immediately. The fifth step, aim for somewhere between 10 and 15 minutes total. Research on postprandial walking generally supports that specific range as enough time to meaningfully blunt a blood sugar and fat spike without requiring anything longer or more demanding of your schedule. The sixth step, prioritize doing this after your two largest meals of the day, which for most people means lunch and dinner, since those two meals tend to carry the biggest and most damaging spikes. The seventh step, if you currently take any blood sugar medication, any cardiac medication, or you live with joint issues that make walking difficult or painful, please talk with your doctor before changing your after-meal routine so that this habit can be tailored safely and specifically to your own situation. The eighth step, track this for 30 straight days using nothing more complicated than a simple calendar and a check mark each time you complete the walk. Because the real win here is built through consistency, not through intensity or perfect form. Most of my patients tell me the calendar itself, seeing an unbroken row of check marks, becomes more motivating than the walk ever was on its own. One optional ninth step that many of my patients find helpful, attach this walk to something you already do every single day without fail, a habit you never forget, such as brushing your teeth afterward or letting the dog out. Linking a new habit to an old, automatic one is one of the most reliable ways behavioral research shows people actually sustain a change like this past the first few motivated weeks, long after the initial excitement of a new routine has naturally worn off. Pick the anchor habit now before you finish watching this video, so tonight is not the night you have to think about it from scratch. One more thing before you go. If this video genuinely helped you today, and if you have your own personal story about a stent, a bypass, or a close call with your heart that you managed to avoid, I would truly love to hear it down in the comments below. And if there is a specific heart-related topic you would like me to cover in an upcoming video, whether that is blood pressure, cholesterol medication questions, or something specific to a diagnosis you are currently navigating, please tell me that as well, because these videos exist directly because of what all of you keep asking for in the comments section week after week, and I genuinely read through every one of them before deciding what to script next. I want to say a genuine, sincere thank you for spending this time with me today, because your heart health is not a small thing to me. It is honestly the entire reason I keep making these videos week after week. If you found real value in this one, please subscribe to the channel and share it with someone in your life who needs to hear it. Because the two of us working together, you actually taking the walk after your next meal, and me continuing to hand you the information that makes it worth doing, is exactly how surgeries like the one mentioned in this video's title get quietly prevented instead of eventually scheduled, one ordinary evening walk at a time, long before a cardiologist ever needs to say the word bypass to you in an exam room. And finally, please remember that this video is intended for general education, and it is not a replacement for personalized medical advice from your own physician who knows your complete history. Your specific heart history, your current medications, and your individual risk factors all matter a great deal, and only a doctor who understands your full picture should be guiding decisions about your individual care going forward. I care about you watching this right now, and that is exactly why I want you working closely alongside a doctor who knows your whole story, in addition to everything you continue to learn here with me. Take care of that heart of yours. I will see you in the next video.